Okay, so Sarah, your line is really breaking. We're struggling to hear you. Can you go over that again, please?
Okay. Is it better now?
Yes, this is good.
Okay, thank you. So I said the misconception we have lots of people, they are made people think that actually has good clarity and what they know or what they do. So the most one I've heard of casual contact is you just casual contact. That means either by hugging, shaking of hands, sharing food, drink, and maybe sharing toilet. However,
Okay.
virus actually lives inside the sleep gets this protection.
All right. I'm Sarah. Unfortunately, we're struggling to hear you. In the meantime, I'll be opening the phone lines for you to be a part of the conversation. You can call us on 07000 917 917 07000 917 917. You can call us if you're a woman on the toll free line or 800 1235 917. Or better still, send us a WhatsApp message on 0703 175 6537. This is Chat for House on Women Radio 91.7. And this is where we get to bring you up to speed with everything that you need to know about your sexual and reproductive health. My name is Blessing Agbeto. And today on the show with me, I have Sarah Tanko. And of course, she has been enlightening us on what we need to know about living with HIV. And then she has gone ahead, or how will I say it now, to differentiate what HIV stands for and then what it stands for. And of course, she has told us how the treatment has evolved over the years. And I think I find that quite interesting, moving from having to take several medications to just having it in just one tablet, and then you still have series of medication put together. I feel like that makes so much sense. Anyways, thank you very much for sharing your thoughts on that one, Sarah. I do appreciate you. All right, Sarah, you were saying something about the common myths or misconceptions about HIV and AIDS, and then your line was breaking earlier. I don't know if we can try again to see if we can hear you properly this time around.
Okay, no problem. Is this better now?
Yes, this sounds well.
Okay. So sorry for my network. So as I was saying, I said the most common misconception I've heard is people asking if HIV can be contacted from casual contact, that is either through shaking of hands, sharing toilets, or by hugging and other things. You understand? So it is important to know that HIV is an infection that actually lives in your body, it's in your blood. You understand? We either have a direct contact with blood, with semen, or breast milk sometimes as well. You understand? So
Wow.
if you don't have a direct contact with blood fluid, you don't have HIV by just shaking of hands or sharing toilet. The other one I've heard is if mosquitoes can
Hmm.
spread
I mean,
HIV.
everyone should have HIV by now.
Exactly. So,
Mm.
and yes. So from the meaning of HIV, human immunodeficiency virus, I think it's clear. It's easy to spot out. Okay, this thing exists in just humans. So it's not possible. The mosquito do not have the capability to accommodate HIV as a virus and to be able to now transmit it to another person. So it is not possible. They cannot transmit the virus that is mosquito feeding on the human body and then passing to another person. It's not possible. Then I think I've also heard questions. I've heard people say that HIV is a death sentence. It's actually not a death sentence. It's just
Hmm.
another phase where you have to be conscious of how you take care of yourself and then you move forward. Then I think another misconception I've also heard is that it's only promiscuous people that get HIV. It's absolutely wrong. That is absolutely not correct. I think today at the facility, I had a case of a 9 years old child
Hmm.
that was brought in and she was tested positive. So her
Wow.
both parents, they were not at all. So and immediately the father came in for counseling because she was admitted, and I just asked him, where has she been taking blood? Because there are either two things that could probably present like that. Either she was raped or
Hmm.
they did blood transfusion on her. So and
Hmm.
he said yes, she has been transfused. She has been transfused because I said where. So he said said he was not in the hospital, because no hospital nowadays will want to transfuse you
Without
that is
screening the
clean for those.
blood. Mm.
But now, cases like that now, you can't say that the child was promiscuous. It was just health negligence, or together with the parent negligence as well.
Mm.
So it is not to a certain set of people. It can be anybody. It can be any race. It can be any gender. Understand? HIV is just something that if it happens, then you go for the way forward. So I
Mm.
think these are some of the
All right,
misconceptions
all
I have.
right. Thank you very, very much for your thoughts on that one. 07000 That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703 1756537. This is Chat for House on Women Radio, WFM 91.7. My country people, Belle by Choice movements don't come again with our annual Belle by Choice campaign tagged 10,000 men give Belle by Choice, not by force challenge. We won't reach 10,000 men and young boys them in various communities with the right information on how they feel support women and girls' sexual and reproductive health, and they inform on modern contraception and family planning matter to end unwanted pregnancies. We won't make our papa, husbands, uncles, and brothers know say women and adolescent girls get right to their body and make them join hands to end rape, child marriage, sexual violence, and kasala wey they cause, such as girls' school dropout and unsafe abortion where they threaten women's lives. If men they involved and supporting sexual and reproductive health and rights matter, it could empower women and adolescent girls to make informed choices about their health and could make them carry belle by choice. The 10,000 men give belle by choice will start 1st of September to 30th December 2024 in Nigeria. If you be man, woman, young girl or boy, join our movement to build a future where choices are made. For more information and inquiries about the campaign program, contact Martina Ebre on 0704 806 5486. Together, let us build a safe environment for women and adolescent girls. Remember, Belle now by choice, not by force. Belle by Choice movement is brought to you by Age and other young women groups them with support from the African Women Development Fund. All right, 13 minutes, 17 minutes past 7 from Women Radio 91.7, Nigeria's first and only radio station for women and their families. And yes, if you are just joining us, you're listening to Chat for Hours on Women Radio 91.7. My name is Blessing Agneto, and today with me on the show, I have Sarah Tanko, a committed healthcare professional content writer dedicated to advancing public health through strategic leadership, advocacy, and impactful communication. And yes, we have been discussing the topic living with HIV, separating fact from fiction among young people. If you have any question you would like to ask, please do well to reach out to us on the show for today. Remember to call us on 07000 917 917 07000 917 917. All right, Sarah, I will be asking you more like a two-in-one question now. I know that earlier on the show you have said something about how HIV can be transmitted. You said through fluid, blood transfusion, cut, and all of that. And I would also like you to shed more light on that. More like, what are the common ways or common modes of HIV transmission? However, we have a call case, so please do well to call us back 07000 917 917. Okay, so and then the other question is, what are the effective ways of preventing HIV transmission?
Okay. So the common ways, effective ways of preventing transmission, I think the first of all, the only method that you can use generally, especially when you're using contraceptive, is condom. Condom is the only contraceptive barrier that can actually prevent HIV. However, it doesn't necessarily prevent other STD, that is sexual transmitted diseases. So aside that, any other form will be preventive method to avoid having direct contact. Let's say, for example, a mother that is breastfeeding her child, a mother that is positive, she would probably not want to breastfeed the child, especially if her viral load is very high. understand? She has to put it on hold and take care of herself, and then the baby will have to go for an alternative. Then you have to avoid the use of sharp object, sharing sharp object that will probably have residue of blood on it. You understand? Misusing sharp object, and also um, do not get transfused without actually that blood, without checking or screening out if it is good or not. So I would highly recommend that if there's need for transfusion, don't even do it in any chemist. Go to the hospital. There's
Mm.
no hospital I think now would want to transfuse without do any proper
Screening.
screening. There's already test to look if your viral load is very high or not. You have to not feed your child and be sure that okay, you can move forward. Although there are instances where you can actually breastfeed your child, we'll go back to that eventually. And then for blood transfusion, please make sure that any blood that is going to be transfused to you is properly screened.
Mm.
Because there are cases where there's need for blood transfusion, ensure that you are in the right facility. In fact, you have the right to ask questions. You understand? In case the blood is not from someone you know, you have
Mm.
every right to ask for curiosity, please. You
Mm.
understand?
Mm.
So these are like the two most
All
important.
right, all right. Thank you very, very much for your thoughts on that one. I think that is quite enlightening, knowing that as a person, it is important for you to not have unprotected sex as a young person, right? Because I mean, sometimes you want to explore. Right, but then ensure that you're not having unprotected sex. And of course, be careful when you want to go for your transfusion. So, thank you very much for sharing your thoughts on that one. And I would also like to ask, I know that we're in that time where people do not want to associate with people living with HIV and AIDS. So, how does stigma affect people living with HIV?
Um, this is a very interesting question. Okay, I think for people living with HIV, I've worked with quite a number of people. So I normally advise that first of all, you have to come to acceptance. It is not easy, but you have to come to acceptance. The way you position yourself, that's how people will accept you. You understand? Yes, there are people that will still probably not want to accept you, but you have to position yourself in a way to move forward from there. Otherwise, you will fall into depression. HIV and depression are close friends. If you don't take care while you understand while coming to terms with it. So it affects people psychologically, it affects people socially, also affect their performance generally. So for people living with HIV, I highly recommend position yourself in the way to accept and then find a way to move forward with it. We lost the patient last month due to
Mm.
this similar case. She was stigmatized. I think she has been living with HIV for like 5 years, but
Mm.
somewhere along the line she fell into depression and she stopped taking her drugs for 1 year plus, and we lost her.
Mm.
So I was talking to her mom, and then I was able to get that okay, this woman was really stigmatized to the point where she just felt like okay, nothing was just moving forward. So I
Mm.
had to recounsel the mother. But I said, no, next time there's a community, there's a support group for this, you understand? So you find people like you express yourself, you understand? You ask questions. There are health workers that are available to talk to you, to hear your complaints, you understand? So it is not a death sentence. You just
Mm.
find a way to move forward
Mm.
with yourself, you understand? But
Mm.
first, start with accepting yourself and moving forward with yourself.
Mm. All right, thank you very much for shedding light on that one. Now that you've talked about how stigma can affect people living with HIV and AIDS, so what is our role as individuals in the community? How can we ensure that people living with HIV and AIDS are not being stigmatized? How can we promote greater understanding and acceptance of people living with HIV and AIDS?
Okay. For people, I think most of the times people that behave like that either ignorant or they just want to be people anyways. Yes, and so but first of all, I'll highly advise you try to enlighten people. You will hardly see me go around with actually making awareness about things like that. Okay,
Mm.
this is what it is, this is a big deal, and this is what it is, and then you enlighten people so that people come to an awareness of how it is and how they can show emotional support. If you don't enlighten people, people don't know what to do. They become scared of what they don't know about himself. So there's a need for us to enlighten. Yes, and sometimes you just randomly you can create seminars, you can have talks on shows on streets, and sometimes you can even talk to your fellow friends or your colleagues around, understand? So that, okay, do you know about this? What do you know about this? You understand? Then you talk about it. So create this sense of awareness. At least a good number of people will be able to know and okay, this is what it's all about. So I think to reduce people from stigmatizing other people, we should be aware, and it is our responsibility to talk about it. If we don't talk about it, they will not know it.
If we don't talk about it, they will not know. Wow, this is exactly why we're having this conversation on Chat for Health today. It is very important for us as individuals to ensure that we show people living with HIV and AIDS love and care as against stigmatizing them. Remember, Sarah has said it oftentimes on the show today that having HIV or being diagnosed with HIV or AIDS is not a death sentence. And that leads me to the question, Sarah, can people living with HIV lead normal and healthy lives? Is it possible? Or once they have it, they cannot, work in an organization, they cannot give birth, they cannot get married, and all of that?
HIV do not affect your performance. It does not affect your performance. Yes, there's no cure, but then it does not affect your performance at all. Sorry, can you come back with the question? I think I skipped.
So I was asking if people with HIV, people who have been diagnosed with HIV, can they lead normal lives?
Can they live normal life? Yes, they can live normal life. They can absolutely live a normal life. So like I said earlier on, it is how you position yourself, understand? The funny thing about HIV, you'll be surprised that maybe in 1 to 10 person you pass every day on the roadside, even your working place, understand? Maybe one
is a carrier already.
Hello?
Yes, I'm with you. Please go on.
Yes. So you'll be surprised that in every day, every blessed day, even the keke driver, your bus driver, understand? 1 in 10 person or 2 in 10 person actually is living with HIV, but you will not know because of how they position themselves and they move forward to live normal life. Yes, you start taking your drugs, you take every other food, and then you move forward. So you can live and you can be very productive as long as you don't allow it to affect your productivity. You'll be very productive. You'll be very true. So it does not affect you. It does not affect your daily life.
All right. Thank you very, very much for letting us on the show today. I think you've said so much. Just before I let you go, I would like to ask you, how can listeners, get tested or access HIV resources?
Okay. I think in every state and every local government, I think down to the local government, there are always health facilities. So in every hospital, there are different units, that different departments that cover different parts of the body. You understand? So for the HIV unit, it is available. So you can go there and locate where it is. Just ask around where is the ARV unit, is antiretroviral unit, so locally directly was HIV, or even if HIV will take you there. Understand? So once you go there, you can present your complaints. Okay, this is it. Because okay, there are cases where you might probably be a high risk and high individual, and high risk individual is probably maybe you have contact, you had a pre or post exposure, you understand? Table your complaint, they'll counsel you properly, then maybe run some tests, then give you some drugs, and then ask you to come back for follow up, you understand? So it is available in every health facility. It's not something that it is hidden. And I think the good news is it's free. It's free.
The consultation is
I don't
free.
think they know that. Yeah, it's free. It's free. Most places actually free, because there are a lot of NGOs that promote and they try to sponsor programs like this. So it costs you no money. It's just you on yourself and then locating the facility, and then you go there for proper counseling and then proper
medical attention. All right. Thank you very, very much, Sarah, for being a part of the conversation for today. Do well to enjoy the rest of your evening.
Thank you so much. Thank you so much for having me.
All right, there you have it from Sarah Tanko on the show today. Today's edition of Chat for Health as brought to you by Age Network in partnership with PEPFAR Nigeria, Gilead Science, and AWDF. Many thanks to our guest, Sarah Tanko, a committed healthcare professional and content writer, for enlightening us on what we need to know about living with HIV. I hope you've been able to take one or two things away from the conversation today. Remember, coming down with HIV is not a death sentence. And if you have anyone with HIV in your environment, it is important that you show them love, show them care, and do not stigmatize. Let's do this again next week, Wednesday, 7 p.m. on Women Radio 91.7. My name is Blessing Agbeito. Good evening.
Really nice. I take it one. I wanna live long. Wanna stay strong. You wanna live long and stay strong. Ogun bílẹ̀ afúnni ni wọ́n sọ, olóyún abẹ́rẹ́, láì ṣiṣẹ́ abẹ́, ewé ń jẹ́, ogun jẹ́.